Namaskar. Today we'll study local anesthetics. As the name suggests, local means the applied area to which we'll apply the drug. It will act at that area only. And anesthesia, that is reversible loss of sensation. So these are the drugs which, when applied to a certain area of our body, produces reversible loss of sensation in that area. So they can be classified as natural and synthetic. Natural, the cocaine has local anesthetic action. Then synthetic nitrogenous compounds like para-amino-benzoic acid derivatives like procaine, amethocane, benzocaine, orthocane. Then acetanilide derivatives like lidocaine. The other name of lidocaine is your xylocaine or lignocaine. These are all same. Then we have quinidine derivatives like cinchocaine or dibucaine, and acridine derivative like bucricaine. Non-nitrogenous compounds like benzyl alcohol, propanediol, and others like phenol, clovol, chlorpromazine, antihistamines all have some local anesthetic action. Then we can use them as injectable or apply locally, either as a drop or ointment or gel. So surface anesthesia. Injectable anesthetics include those with low potency and small duration of action, that is procaine, chlorprocaine. Intermediate potency and duration of action, and lidocaine, prilocaine. Then high potency and long duration, cinchocaine, tetracaine, bupivacaine, and ropivacaine. Surface anesthesia includes soluble like cocaine, lidocaine, and insoluble like benzocaine. So you can see this lidocaine or xylocaine or lignocaine can be used as both injectable as well as surface anesthesia. So what is the mechanism of action? They actually inhibit the generation and conduction of impulse, so that the sensation feeling is not there, the pain sensation is not there, and they do this by blocking the sodium channel. As you know, this sodium channel exists in three states: the open state, the inactive state, and the closed state. So once the sodium channel opens due to any stimulus, that undergoes this inactive state, during which another stimulus cannot open the sodium channel. So after this inactive state only, it comes back to the closed or resting state, in which another stimulus, now say pain stimulus here, can open, and that will cause opening of sodium channel, and this sodium is required for generation and conduction of impulses. So the local anesthetics, they block this inactive state. So by blocking this inactive state, they prolong this inactive period, the period for this inactive state, that is called refractory period. They prolong this one, so they delay the sodium channel to come back to its closed state. So it will delay the opening of sodium channel. So in this way, it stops the impulse conduction, and this occurs when there is pain stimulus. So when there is pain stimulus, the nerve is stimulated repeatedly. So it increases the frequency of opening. So increases the frequency of opening means the duration is actually decreasing. Why this duration is decreasing? Because the sodium channel is remaining for a less period in this inactive state. So if we prolong this period, or during which the sodium channel remains in inactive state, if we prolong this, then we will delay the sodium channel to come back to its resting state. So only when the sodium channel is in resting state, then only pen stimulus can open the sodium channel. So in this way, we can we can say the sodium channel blocked by local anesthetics is frequency dependent. So those sodium channels which have high frequency due to the pen stimulus, they are blocked. Again, the local anesthetics can be your quaternary or tertiary, and all these quaternary local anesthetics, they enter into the cell membrane through the sodium channel. So when the sodium channel is open, they enter. Tertiary local anesthetics, they can pass through the cell membrane or through the pores. So they can act even when the sodium channel is not open. So both this quaternary local anesthetics and tertiary local anesthetics, they enter inside. Quaternary local anesthetics when it is in the open state, and tertiary local anesthetics when it is not in the open state, it can enter through the cell membrane. So they enter inside and blocks this inactive state. So what happens? They don't have any action on the resting membrane potential. So whenever any pen stimulus comes, it elevates the resting membrane potential of the nerve or nerve fiber, and once any pen stimulus which can cross the threshold potential, which can elevate the resting membrane potential above this threshold potential, it will depolarize followed by repolarization. So these local anesthetics does not produce any hyperpolarization. They simply decrease the potential, so that means the depolarization fails because of the local anesthetics. And you can see at low concentration, this is the figure. If you increase the local anesthetic, this is the figure, and at high concentration, this is the figure. That means this resting membrane potential, from this resting membrane potential which is unaltered here, this threshold potential is not crossed here. So it remains below the threshold potential, because if it cannot cross the threshold potential, there will be no depolarization. That means there will be no sodium channel opening, no impulse conduction or no impulse generation. So you can see this drug simply, these local anesthetics, they simply decrease this maximum depolarization, and the depolarization finally fails to reach the threshold potential, and that's why the conduction blocks. So the depolarization fails to reach the threshold potential by the local anesthetics. Okay, in this way, the impulse generation and impulse conduction both are blocked by the local anesthetics. So the use of local anesthetics, they can be used as surface anesthesia, locally applied, and as injections we can block the conduction. So conduction block anesthesia injected around the nerve trunk, or we can block certain segment of our body by using spinal anesthesia, epidural anesthesia, and infiltration anesthesia means to the applied area will inject the drug under the skin, infiltration anesthesia, and we can do intravenous regional or infiltration anesthesia in a vein by using a tourniquet. So in a tourniquet occluded limb we can do that, so that part of the body can be anesthetized. Drug interaction, local anesthesia, if we give an injection of adrenaline along with the local anesthetic, then because of the vasoconstrictor action of the adrenaline, the drug, the local anesthetic will be remaining at the applied area only, so that will increase the efficacy and limit its systemic toxicity. It will prevent the systemic toxicity of the local anesthetic because of the vasoconstrictor action of the adrenaline. Thank you.